So what type of advice would you have for students who are considering going to a career in primary care behavioral health, or maybe even people who are looking to transform their career from traditional settings to primary care?
Well, I think that what is probably most important for a mental health or behavioral health provider from the specialty world who wants to get into primary care, what's most important for them to understand is what primary care really is all about, right? So in order to operate effectively and efficiently in primary care, you have to understand that. You have to understand what primary care is all about. I think too often when mental health providers come into primary care, all that they know is what mental health is about.
Yeah.
They know the specialty world. And they try to bring that then into primary care, and they try to replicate that in primary care. The problem is that the function of primary care in the healthcare system is entirely different from the function of the specialty care sectors, right? And in particular, especially mental health. Primary care has a completely different role and function in the healthcare system. So I think that the most important thing for someone who thinks they want to work in primary care is make sure you really understand what primary care is all about, right? How are the goals of primary care different from the goals of specialty care? How is the culture of primary care different from the culture of specialty mental health settings? How are the practices of providers in primary care different from the practices of providers in the specialty world? Because if you're coming into primary care and trying to make it into something it's not, trying to make it into a specialty,
Yeah.
then you're not going to sync up very well, right? With primary care.
How would one find that out? Like you said, how do you learn about what primary care is all about? Any suggestions, advice?
You know, honestly, I would recommend shadowing a primary care physician for a day, for as many days as you could. You know, there's nothing like shadowing a primary care physician to really start to understand, you know, what primary care is all about and what it looks like and what the pressures are and what the patients are like and these kinds of things. So, you know, these days, if for students who are interested in applying to medical school, they all have to shadow physicians, often primary care physicians, for a certain number of hours, you know, before they can apply and be accepted to medical school. And I think it would be great if we could do something similar, you know, for anybody who wanted to go into primary care behavioral health, right?
Yeah, in order to be effective in the culture, you got to understand what the culture is.
You've got to understand what the culture is, exactly. And I think so many of the challenges and the problems and the things that just haven't worked right with integration to date have been the result of people from the specialty mental health world trying to come into primary care and impose some sort of specialty care on primary care or try to make primary care function more like a specialty. And they run up into a brick wall when they try to do that.
Yeah.
So.